Artefill is a permanent aesthetic injectable implant for the correction of nasolabial folds. Artefill is designed to improve patient satisfaction by addressing the growing demand for a safe and persistent injectable dermal filler. Artefill is a proprietary combination of Artefill precision-filtered microspheres, suspended in a carrier gel consisting of Artefill purified bovine collagen, with 0.3% lidocaine for patient comfort. Artefill microspheres are made of polymethyl methacrylate, or PMMA, one of the most widely used synthetic implant materials in medicine. These microspheres are 30 to 50 microns in size, non-absorbable, and have a round and smooth surface. Following injection, the PMMA microspheres in Artefill remain at the injection site and provide a permanent support matrix for persistent wrinkle correction. While the bovine collagen is gradually absorbed, the microspheres become a permanent part of the patient's own tissue. As with any dermal filler, proper injection technique is essential for optimal treatment results. Artefill is injected in the nasolabial folds using the tunneling or retrograde linear threading technique. Depending upon the thickness of the skin, the needle is inserted into the dermal-subdermal junction at a 20 to 40 degree angle. While withdrawing the needle, constant pressure is applied on the syringe plunger to ensure optimal deposition of Artefill. When the needle is in the correct plane and depth, resistance will be felt during injection. Take before treatment photos. Clean the area to be treated. Determine if the patient wants any kind of anesthetic and present the options. Provide the patient with a hand mirror so they may follow along while the treatment progresses and compare the treated and untreated sides. Each Artefill kit contains a set of 5 pre-filled syringes and 26-gauge 5/8 inch needles. The Artefill syringe should be brought to room temperature before injection. Artefill is injected with a 26-gauge needle. To assemble, remove the tip cap from the hub, then tightly secure the needle to the syringe by twisting it. The hub should be fully seated in the syringe. When the needle and syringe are securely assembled, pull off the guard and express a tiny drop of Artefill to ensure the needle is not clogged. Begin injecting at the distal portion of the fold and advance toward the nasal triangle. The outline of the needle is visible, but the gray of the needle cannot be seen. As the needle is withdrawn, apply constant pressure on the syringe plunger to ensure uniform deposition of material. Remember to stop injecting before fully withdrawing the needle. If needle placement is too superficial, the gray of the needle will be visible through the skin. Tissue blanching will be observed upon injection. Stop the injection and reinsert the needle to the proper depth. If needle placement is too deep, the physician will feel the needle pop through the dermis into the subcutaneous tissue and there will be minimal or no results. Stop the injection and reinsert the needle to the proper depth. Overcorrection with Artefill is not recommended. Several treatment sessions may be required to achieve optimal correction. An inadequate volume of Artefill may result in undercorrection, leading to patient dissatisfaction. Remember that if you use an inadequate volume of Artefill, the treatment result will be minimal and patient dissatisfaction may occur as a result. After injection, palpate the injected furrow to confirm uniform deposition of Artefill. Massage gently to smooth any palpable lumps. Material that has been injected too superficially may be distributed into the surrounding dermis using a gloved thumbnail and scraping motions. During the consultation process, the physician and patient should discuss the desired results. Artefill Progressive Enhancement is used to provide optimal wrinkle correction in stages. When performing a touch-up procedure, palpate the original treatment area to determine the location of the first implant. Insert the needle above the first implant and beneath the dermal crease into the deep dermis. Using the tunneling technique, repeat the injection process used in the initial treatment session. The layers of subdermal strands form a support structure to correct the wrinkle and to prevent further wrinkling. With Artefill Progressive Enhancement, 1 or 2 successive treatments at intervals of approximately 4 to 6 weeks may be necessary to achieve the desired level of correction. This female patient is shown before treatment, 6 months after injection with Artefill, and 1 year post-injection. This male patient is shown before treatment, 6 months after injection with Artefill, and 1 year post-injection. The Artefill Physician Training Program provides comprehensive training prior to the use of Artefill in a clinician's practice. Please refer to the Artefill and Skin Test instructions for use for complete information on contraindications, warnings, precautions, and adverse events. Committed to maximizing patient and physician satisfaction with Artefill by providing a training program that fosters consistent and high-quality injection results.